I'm Professor Chang Young-eun of Conservative Dentistry. Today I'm going to talk about post-op pain after endodontic treatment. There are a lot of studies on post-op pain after endodontic treatment. In this lecture, I'm going to talk about how the pre-op mechanical allodynia affects post-op pain. In maxillo-orofacial sphere, the most common pain is odontogenic pain, which can be divided into pulpal pain and periapical pain. Pulpal pain can be expressed as a spontaneous pain and thermal pain, and periapical pain as mechanical allodynia. In this case, patient feels pain even though there's no stimulation due to reduction in mechanical pain threshold. Patient shows a sensitivity to percussion, biting, or pressure. The pulpal pain and periapical pain can appear at the same time or they can appear separately. The existing studies on endodontic surgery post-op pain did not differentiate these types of pain and only on spontaneous pain. The studies did not differentiate pulpal pain from periapical pain and looked into how it changed before and after surgery. The study aim is to assess the changes in the intensity of mechanical allodynia and to identify predictors of post-operative pain after root canal treatment. The study was done on 579 patients who visited the conservative dental department in Ewha Women's Mokdong Hospital from May 2016 to May 2018. VAS scale was used to statistically look at the pre-op and post-op pain. On the left is no pain, on the right is the unimaginable amount of pain. This was explained to the patient and patient was to mark the level of pain. Pre-op pain assessment was made. The patient was to mark the level of pain after the clinician tapped upon the problematic tooth at first visit and after biting on cotton wool. Out of the two, the higher value was chosen as the mechanical allodynia strength. The study subjects had 2 to 3 endodontic treatments. The post-operative pain can be divided into post-preparation pain, which is made at the beginning of each visit, and post-obturation pain. The patient was to mark the highest pain experienced in the bus. The patient was to record the maximum amount of pain experienced for the 6 days following root canal treatment. At day 7, the patient was to make a revisit and evaluation was done. Depending on pre-op pain level, the subjects were divided into 2 groups. Those with less than VAS score 4 were classified as non to mild group. Those over 4 were classified as moderate to severe group. Changes in pain were evaluated. This is the result of mechanical allodynia pain intensity. The horizontal axis reflects time. On the left is pre-op and on the right is post-op canal filling day 7. The vertical axis reflects VAS score. The pain intensity level is shown. The blue is moderate to severe group and green is non to mild group. With the start of root canal treatment in the moderate to severe group, there is meaningful decrease in periapical pain, but statistically compared with a mild group, in terms of intensity, it was meaningfully higher. However, the 2 groups did not show meaningful difference in terms of pain intensity for 7 days after canal filling. Black line was used to see the changes in mechanical allodynia. Those above the black line experienced increased pain, whereas those below experienced a decrease. 26% of the non to mild group experienced pain increase, as shown on the left. The increased intensity was either mild or, in few cases, moderate or above. Compared to moderate to severe group on the right, the non to mild group showed significantly higher number of patients expressing increased pain. If you look at the moderate to severe group on the right, the number of patients experiencing increased pain was significantly lower. However, the increased intensity was either moderate or above. 92% of the second group experienced a decreased pain after root canal treatment. Throughout the endodontic treatment, in moderate to severe group, meaningfully more number of patients experienced a decreased pain compared to non to mild group. Next, a single logistic regression analysis was done to identify various pre-op elements in order to anticipate post-op periapical pain of moderate or above. The variables on the left show age, gender, previous dental treatment, whether the patient received a root canal treatment before, tooth form and pulp condition, pre-op mechanical allodynia, whether it was moderate or above, periapical lesion, and whether there was a scalar extrusion. These factors were considered. I'm going to talk about factors that showed meaningful relevance to post-op periapical pain of moderate or above. The factors include posterior teeth, pulp necrosis, and existence of mechanical allodynia of moderate or above. These three factors were used for multivariate logistics regression analysis. Pre-op mechanical allodynia of moderate or above was found to be a risk factor. If such mechanical allodynia exists pre-op, in post-op, there can be periapical pain of moderate or above. Now I'm going to summarize. In the case of patient with less than moderate level of periapical pain pre-op, the intensity of post-op pain was also mild, but in 30% there was increased pain. In the case of patient with over a moderate level of pain before treatment, they experienced a higher post-op pain, but in over 90% of the patients, compared with pre-op, pain decreased. If the patient experiences periapical pain of moderate or above, we can anticipate that the patient is going to experience moderate or above level of post-op pain. Changes in the intensity of pain before and after endodontic treatment, and when the patient can anticipate more pain after treatment. If we can inform the patient of what kind of pain to expect after treatment before we provide the actual treatment, and pay more attention to minimize such pain, I believe we'll be able to build trust with the patient and get good treatment results. I hope my lecture was of help.